Good morning, everybody. Did you know that a manual version with an OB has about a 60% success rate of getting baby to go head down? And moxibustion has about 75% success rate. And Webster technique with a certified chiropractor has a 80 to 95% success rate. So why don't people start with the Webster technique? My name is Dr. Chelsea Moe. I am a prenatal and postnatal chiropractor here in Rochester, New York, and it is my mission and goal for you to have the dream labor and delivery that you've always wanted and for everything to go smoothly. But if your baby's in the wrong position, you are likely at jeopardy of that. And so what we want to talk about today is how you can help prevent anything from happening as far as baby's positioning, or if you're already in that space and baby's already not in the great position, what you can do besides just waiting for a manual version or waiting for a C-section. So chiropractic is a well-known way of checking your spine and your nervous system throughout pregnancy. But one step further, there's an analysis that chiropractors can get certified in called Webster technique. Webster technique was a technique developed and founded by a chiropractor named Larry Webster, and he was finding that a lot of these pregnant moms he was seeing ended up with really great labor and delivery results, whether that means a faster delivery, an easier delivery, a safer delivery, or they avoided a C-section or a version because they got baby into the best position. So he started saying, okay, there's something to this. There's a specific analysis we do in the pelvis as chiropractors to help make sure your pelvis is in a really great position so that baby has the right space to be head down. So what that looks like is you see this perfect little kidney bean shaped outlet here. Your baby is living in there right now. And if there's any kind of torque on mom's pelvis, we call that in utero constraint on the baby. So basically, as the bony structure torques, it's going to pull muscles and ligaments with it, and it's going to put stress on the nervous system that's associated with this area as well. All these little yellow guys are the nerves. So if there's any kind of torquing in the pelvis, which basically at this point in your age there probably is, that maybe even started during your birth, and so it's going to take a lot of repetitive input into the pelvis and nervous system for it to create a stable environment. But once that stable environment is achieved, we get a normal alignment, we get more balanced muscle and ligament tissues, as well as a relaxed nervous system. Then baby innately has the space and environment to go head down because there isn't all that structure in the way. So what we do is we gently guide things in a right alignment, get things functioning properly, and then baby innately on their own gets into the best position for them. So there's nothing external, there's nothing like that we do any kind of manual version or anything like that. It's really just giving the mama the best alignment in her pelvis, the best function in her nervous system, and balancing some soft tissue that really creates that safe, awesome environment for baby to do its job that they know that they need to do. So that's the Webster technique in a nutshell. And the best time to start with this is now. So whether you are somebody who's watching this and you are either struggling to get pregnant or you already struggled to get pregnant, if you know of anybody who's struggling to get pregnant, the best time to start with this is now. Because most people think about chiropractic for aches and pains towards the back end, or for Webster technique towards the back end of their pregnancy, to help try and reverse a lot of the pain or a baby's misposition. But if you start now, this technique isn't just used on somebody with a breech or transverse baby. This technique can be used and should be used by a chiropractor on every pregnant mom's or trying to get pregnant mom's visit, just to make sure that the pelvis is in a really great alignment, and then again that the nervous system that's communicating between the brain and the pelvis back up to the brain, that includes a lot of the reproductive organs and hormones, are functioning and wiring appropriately so that mama can get pregnant naturally on her own. If you are somebody who is pregnant and you're in those first couple of stages of your pregnancy, maybe the first or second trimester, and nobody's talked to you about your baby's positioning, or maybe they've said, baby's breech right now, but it's okay, it's early, there's a lot of time for them to move around. The likelihood of baby getting in a really great ideal position head down at that point, afterwards on their own, if your pelvis is torqued, which about 95 to 100% of us has some sort of misalignment or torque in our pelvis, then the likelihood of the baby's position to get better is slim, in my opinion. But if we want to be proactive about this and start in those first couple of months or first couple of trimesters, that's ideal so that we don't have to go down this road of a lot of these moms who have crunch time at the end. These 36 to 40 week mamas who are then like finding out baby's breech or transverse, and now it's go time. Now it's time to really start all these extra appointments, all these extra homework assignments that they have to do to try and get baby into a great position so that they can still have that dream labor and delivery that they have for themselves and their baby. So, if you are somebody, like I just mentioned, in that kind of crunch time, oftentimes we are people's last resort, or sometimes kind of that right before, maybe the day before their version, they come in to see me. And likelihood, the stress in the pelvis has been going on for a long period of time. So the more time we have to work on balancing these things out, the better the outcome, the sooner and the best chance you have of achieving your goal for baby to go head down on their own. So, but if you are one of those crunch time people, the sooner the better. Get in ASAP. Call a pediatric and prenatal chiropractor in like 5 minutes when I'm done here. So if you're somebody in that crunch time, don't wait until it's too late. Or if you're somebody who sees the light at the end of the tunnel and you're just kind of struggling through your pregnancy, whether it's you're not sleeping, you're having low back pain or sciatica or pubic pain or pelvic instability, headaches, don't just suffer through the last couple of days or weeks of your pregnancy. Even though you can see the light at the end of the tunnel, the likelihood of those things getting better postpartum when you have this new baby you're looking down at, or nursing, or bottle feeding, or washing dishes, washing nursing pump supplies, and all that stuff, and new emotional stress in your life, the likelihood of that stuff getting better is pretty slim. So do something about it now so that you can be the best mama that you can possibly be for your baby postpartum. We also see often a lot of repeat baby position problems with parents too. So if you're somebody who maybe had a C-section for your first kiddo or second kiddo because of positioning and baby being breech and transverse, and they're just automatically scheduling you for a C-section for this third one, well, guess what? If you didn't do anything to correct the alignment of your pelvis and the soft tissue in the first place, in those first 1 or 2 pregnancies, if you can get that balanced, maybe you can go for a VBAC or something if that's your desire. So I hope I touched on some of your stories, and I really want to help you and guide you through these last couple weeks of your pregnancy, or maybe you're starting early. Please contact me through our website, treeofliferock.com. You can send me a message through there, or you can request an appointment in our top right corner. Do it now. Don't wait for things to be in a breech or transverse time, because those last couple weeks of your maternity leave, you don't want to be rushing to all these different appointments and homework assignments. I have seen it time and time again in our office. And you want that time, if you have a couple weeks off of work before baby comes, to be blissful and relaxing and doing yoga and stretching and going for walks and folding baby clothes. I don't want you rushing to all these appointments and stressed out, because likelihood of you're stressed out, your baby's stressed out, and then I'm going to have to check them too. So come on in, give us a call, request an appointment on our website, treeofliferock.com. I'm Dr. Chelsea Moe with Tree of Life Chiropractic. I would love to serve your family. Have a blessed day, guys. Bye.